Good afternoon. I'm going to go over a couple highlights out of the packet of information that you received from Mary Beth. The first thing is I wanted to give you an update on our PBHCI grant, which is our integrated healthcare grant. We've held a desktop exercise with Center for Family Health to walk through an ideal design for our physician services. So currently, Center for Family Health is situated in the back of our building. They have a satellite office in the back of our building on West Ave. And then we have our psychiatrists that are in a secondary area of our building. And so we've gone through a desktop design to try to figure out what the best workflow is for those services to be as integrated as possible. The intent of the redesign is to achieve true integration, not co-location, but actually integrate behavioral health and primary health together. We have filled 2 of the positions, the medical services director and a quality improvement specialist, and we still have 2 positions posted and are currently interviewing for them. We are working on contract negotiations with Henry Ford Allegiance Health, as we'll be contracting with them for prevention and wellness activities through their It's Your Life program. And the program is scheduled to begin in this month. And the project plan is continuing to be developed right now. The Michigan Association of Community Health Boards, there is a behavioral health and corrections work group that's happening right now, and Mary Beth does sit on that work group. There is a part of the work group right now, their next steps is they're working on creating a strategic plan on how to, as part of the Stepping Up initiative between mentally ill adults in the jail. So ways to create opportunities for individuals who are mentally ill to be diverted from the jails into treatment. The one thing she did want me to let you know is currently, for those, this would be an unfunded mandate right now. We have a new website that went live, and we have a new commercial that's finished and in production. It's going to air on JTV. It's going to air in a loop on the Secretary of State's offices, both in Jackson and Hillsdale, and is also in the movie theaters in Jackson and Hillsdale. It'll be on K105.3's website as a pre-roll when you're listening, and all our brochures have been translated to Spanish. Community relations, yeah, Spanish. Community relations, we're seeking funding for Save Our Youth project to develop a court diversion program for individuals aged 19 to 26 who are first-time offenders to receive additional supports instead of a jail sentence. This is a high-risk population, and these youth are usually targeted for residential placement. The end result of this would be hopefully realizing some community savings due to an increased coordination of care and getting those individuals out of the jail or juvenile system into treatment and treatment systems. Veteran services, this is a general fund issue for the CMHs. So the department has released some information regarding veteran services that are required of the CMHs in the state of Michigan. The CMHs do support this initiative, but we want to work with the department to support the funding needed. So this is a funding stream for veterans. If the veterans do not qualify for Medicaid, though, it would come out of the general fund bucket. One of the requirements is that the CMH has an identified VA liaison, and it must be a peer, so we're working on that. The MDHHS 1115 super waiver update, they've been notified that the current review has been extended for 3 months at the federal level, and so there is continuing to be an evaluation process by the Centers for Medicaid and Medicare for the state of Michigan's request for a waiver. Certificate of Need pilot program. Lifeways has been participating with our PIHP and a Certificate of Need data gathering. So for those individuals who have been deemed eligible and screened for psychiatric inpatient for the last almost a year now, we've been collecting data on those people who are difficult to place, beds that are not available, beds that are not accessible to individuals looking for inpatient supports. Mission, our PIHP, has expanded this to a statewide pilot. They received $40,000 and they are working with a vendor right now to create a database that all of the CMHs will put data into that will then be shared with the Certificate of Need Commission at the state level. The statewide expansion is targeted for March or April. I actually attended a session last week at a conference and got to see some of the screenshots of it. It seems very user-friendly, and they're going to be able to pull some very significant data out there related to denial reasons, facilities that are denying. They also added 150 beds to the state count. These are beds targeted for youth I remember correctly, and individuals with intellectual and developmental disabilities, but currently no additional beds for persons with severe mental illness. Updates to the current program will require emergency services and access points to complete the web-based screen. So that web-based application, that database, throughout the state, all of the access centers will be able to access this and put the information in for the state to review. The Certificate of Need Committee will then conduct a data analysis on the pattern of denials and admission and follow-up. So I know that initially on the pilot, they did do some follow-up with the local hospitals related to denial rates. This committee is also looking into a do not admit list of hospitals. Hospitals are reporting that they have, or it's being reported, that they have lists of consumers that they refuse to admit, and they're on a do not admit list. So the Certificate of Need Committee is also looking into that. And those would be the highlights from Mary Beth's report.
Committee, any questions for Shannon? Dr. Thomas?
Okay, so depending on what they're presenting for, so if they were presenting at our door for services, not in crisis, they would be screened for eligibility for CMH services, and then based upon that screen, referred in for an intake or referred out through a warm transfer to another provider. So if the person comes in and they are screened out because they are the mild to moderate population and their Medicaid health plan has a benefit, we would do a warm transfer to a provider in their Medicaid health plans network. If they are moderate to severe, then we would serve them and send them to a provider within our network. If the person presents at our front door for crisis services, we would complete a crisis intervention, and depending on the outcome of that, if inpatient was deemed the necessary level of care for that individual, we are responsible to screen them for the inpatient stay and then coordinate with a hospital for placement. Prison population, we currently work with PCS, which is a provider here in the county that works with the severely mentally ill in the prison population. So people that are identified during the parole process out of the prison who were receiving mental health services in the prison may be referred to PCS and then referred into us for services, ongoing services afterwards. We also work with, both in Jackson and Hillsdale, we work with the Community MPRI program, the Michigan Prisoner Reentry Program. These are people that are not deemed severe in the prison population, but upon their discharge, their parole out of the prison, may need mental health services. And so we participate in what's called an in-reach with the local probation officers and parole officers to identify them through a phone screen, whether or not they would need services afterwards. During work hours, please send them to us. During business hours, 8 to 7, please send them to us. They should come over. There you go. Yes.
Thank you.
Yes. Yep. So during work hours, our crisis center is open and available to individuals. After hours, we have staff available 24/7 to respond to the ER. So if it was after hours, the person should present to the ER, and then they will call us to come in.
Okay. All right. Thank you.
I have one question.
Yes.
I'm not sure how you're going to want to answer this, but when people are at Henry Ford Allegiance and they're turned away, what are they primarily turned away for? I'm talking about our behavioral health population.
People being presenting for inpatient stay?
Correct.
If I recall correctly, and I can get you the actual data, but my recollection of the last report was milieu so the person didn't fit the milieu of the unit at the time, and they did not have an appropriate bed available to them. So the person may have needed one-on-one support, and they didn't have the ability to provide that, or this was a female and they only had male beds available.
Okay, yeah, I would agree with you on that. I've heard the same thing. Also, unfortunately, there's other reasons too. But,
Yes, sir, yes.
But we'll leave that one right now. All right, anybody else have any comments? All right, thank you very much for your time.
Okay, good afternoon. And I'm Marcy Wandel. I'm the Director of the Jackson County Department on Aging, and I wanted to start out with a brief overview of Department on Aging services. And our mission is to help older adults live more full, active, and independent lives, and we also support caregivers of people who are caring for someone who's older. And for the Board of Commissioners' strategic priorities, we primarily focus on healthy communities and also community and social supports, because what we're trying to do is keep people active so that they are healthy, but if they need more assistance in the home, then we provide services for in the home. So the senior site activities are a more active part of services we provide, and then our home services are just as that describes, in the home. So senior site services are nutritious meals in various classes, and we provided over 45,000 meals in 2016 to almost 1,300 older adults. And each meal provides 1/3 of the dietary requirement. We do have a dietitian that approves all of our menus. And then over 2,000 people participated in 77 different senior center programs that were offered last year. So then our home side, our home services, here's a list of the different in-home services that we provide, with Meals on Wheels being the largest. And we served over close to 1,200 homebound older adults last year. Our meals went up almost 21% since 2013 when comparing to 2016. So with our Meals on Wheels, it's 1,067 meals a day average. When you add our senior site meals, it's about 1,200 meals a day that are prepared and provided. And someone who's getting Meals on Wheels can get a hot meal for lunch, and then also a cold meal for supper, and also in frozen meals for the weekend if they need it. So up to 14 meals a week. And our revenue sources, 40% are grants, primarily Region 2 Area Agency on Aging, and senior millage is an important component, $0.25 and then other income is 24% of the revenue, I should say. And with our funding, both primarily with Older Americans Act and senior millage, we don't charge a set fee. It's we have suggested donations. Yes. Percentage in 2016, 36%. And the point I like to make when I'm talking with people is if anyone has a question about what services are available, to please call us. Even if we don't directly provide the service, we want people to call us and we'll connect them with the resources that are available. And also our website's pretty great. There's in the menu on the left, it says Community Resources, and when people click on that, there's a list by topic. So people can go to that list and get the most current information as far as who to call, the phone number, and a little summary about what's programmed that they're describing, such as housing assistance, ramps, senior apartments, that type of thing. And this was a photo of our last department-wide training in last April. So this is, again, just a summary of what we do. Let me get just back to your... And last week we had a reporter from Jackson Magazine come and talk with our aging leadership team. So Jackson Magazine plans to have an article in the April issue of Jackson Magazine. So that'll be good to have. Again, get the word out about what services that we provide. And we work with a nonprofit called Friends of Jackson Seniors. They've been here in the past to receive recognition, a proclamation from the County Board of Commissioners for their donations to the Department on Aging for Meals on Wheels. And Friends of Jackson Seniors submitted an application to the Weatherwax Foundation for funding to have new flooring placed in Crouch Senior Center in the dining room and multipurpose room, and also funding to paint the walls in the senior center portion of our floor. So those two rooms and the hallway and the lobbies in the senior center portion. So we're looking forward to having that work done, and we're coordinating with the facilities project manager to have everything in place so that we can have some vinyl flooring placed over the current flooring that's there now. It was been original to the building when it was built in the 1960s, and then have walls painted different colors. So that'll be great. And we will have an open house in May. That I'll let you know about that. But the other thing that will happen, in order for the workers to be able to have all this happen as far as laying floor and the painting, just Crouch Senior Center will be closed March 6th through 10th. We're encouraging our participants to go to other nutrition sites, but also the week before, if they want to take home frozen meals to have on hand at home for the next week, we will provide those meals. And all other sites will be open. All our other Department on Aging programs will continue as usual. It's just Crouch Senior Center that will be closed for that week. More for safety. We don't want older adults walking around ladders for people who are painting and laying floors, so that's why we're closing Crouch for that week. Friends of Jackson Seniors and the Department on Aging, this will be our third event to raise money for Meals on Wheels. It's called Soups On for Seniors, and there's information in my report. But it's March 2nd in the evening at Ella Sharp Museum, 5:30 to 7:30. And people can call and reserve a ticket if they would like to come, and then just pick it up, pay for the ticket that evening. And then I also included in the report recent donations from the community to the Department on Aging, which we very much appreciate, all these donations from members of the community. And we have one of our grants through the Area Agency on Aging is called Caregiver Supplemental Services, or what we call unmet needs. And this was, last summer was the second year that we partnered with Disability Connections, where the grant paid for the supplies for the ramps, and then Disability Connections coordinating the installation of the ramps for situations where someone age 60 and older is caring for someone of any age, or someone who needs the care is over age 60. So there's Leslie Krantz coordinates that program, and she gives a description of the 4 ramps that were built. And so that grant has been a big benefit to having more accessibility for older adults to get out of their house, and for the caregivers too, to be able to safely get their loved one out of the house to doctor's appointments or whatever activity they like to go to. And then the Improved Work Environment team with the County Administrator's Office started a Values Award recognition, and the Jackson County Department on Aging leadership team was one of the first staff groups to receive recognition for the Jackson County values. So I included a photo of our great team that received that recognition. And I have a thank you note I'll read from one of our program participants, but before that, are there any questions?
Mic's not working. All right, there it goes. Thought I was Commissioner Duckham for a minute. I just want to, I mean, you have a lot of wonderful information here, and obviously myself being on the Region 2 AAA for quite a long time and being very involved, I'm fortunate to have a lot of knowledge about that. I just wanted to make a comment, though, about how much is being done for the unmet needs for caregivers, not just for the Department of Aging, but a lot of different organizations, because certainly my wife and I understand what's to be a caregiver currently, and you and I have had many conversations about that, and I just want to say that what's being done, again, with caregivers is very important because it's definitely needed, so I just want to say thanks.
Yeah, thank you. We recently received a card from a CHORE program participant. It says, "Your kindness means much more than words could ever say." And then they wrote, "Thank you for the rails on my stair. They make it a lot easier to get up and down the stairs." So that's what the CHORE program does, is install grab bars and stair railings just so people can more safely get up and down the stairs. So it was nice that someone took the time to send us a thank you note. So, thank you.
Thanks, Marcy. And now we have the Health Department. Richard?
Thank you. Good afternoon. I think the next item on your agenda is the contracted service agreement for early on programming services. This is the local funds piece from the Jackson County Intermediate School District. And we talked about this last month when we approved the other contract. So this is pretty straightforward. It's basically the Intermediate School District's additional local funds contribution to the Health Department for early on service programming, and the amount is, I believe, $52,381. So we would ask for your support to move this forward.
Board will be looking for a motion and a support.
Make a motion.
Okay. Comments or excuse me, comments or questions? All those in favor, so we're saying aye. Not, same signal. All right, thank you. Okay, monthly report, Richard.
Thank you. My report, of course, is in board docs, and it's relatively short this time, and I intend to really focus on the really important stuff from my perspective to share with you. We did provide input to an amendment, or a planned amendment, if you will, of Section 14 of the City of Jackson's ordinances. This has to do with the portion of their ordinance that deals with registration and inspection of rental-owned properties, and the content that we provided to them was specifically oriented toward advancing childhood lead poisoning prevention. So we responded to a request from the city manager to that. We did apply for a accreditation preparation mini grant last month through the Michigan Public Health Institute. They are the organization who received the funds from MDHHS, and we asked for some support to facilitate a strategic planning process here for the health department and the community. And I received notice today that we have received that award, so we'll be busy over the next 6 months completing a strategic planning process, and we do intend to include all of you in that, at least through probably a survey asking you to respond to some specific questions about the health department and its services. So we're excited to get that going. There's a lot of conversation and discussion going on nationally and even sometimes here within Michigan as well concerning the future of the Affordable Care Act. So my report does contain some information about what it means for core public health funding. I won't go into the exact specifics of this particular paragraph, but I did also include an additional attachment in board docs for you that really gets more down into the specific concerns about the prevention and public health funding that is part of the Affordable Care Act. So everything from diabetes prevention to epidemiology, lab capacity funds, healthcare associated infections, heart disease and stroke. Those are on the first page of that attachment. But back on the second page is probably really more where we see the direct impact, if you will, affecting us potentially here at the local level. So under lead poisoning prevention funds, activities that provide the initiation for environmental investigations that lead to lead abatement, that lead to abatement of lead hazards in homes, that's a big concern that we have. Communities might no longer be able to utilize surveillance data to target high-risk groups and geographic areas for population-based intervention. So if what that means is that the state doesn't have the capacity anymore to generate, for example, annual lead reports that give us all the information about all the testing that's taking place in the community by age group, et cetera, that's a huge concern for us because that makes us a lot more potentially data-driven in our efforts than what we currently are. So we certainly wouldn't want to see that go away. The National Media Campaign on Tobacco Use the funding supports the Tobacco Quit Line. The 800 Quit Line has been around in Michigan for probably 20 to 30 years. And you may be aware that what happened in the Affordable Care Act is that a lot of the CDC core funding was moved from its normal funding streams through Congress into the Prevention and Public Health Fund of the ACA for protection reasons. Now that we're talking about basically repealing the Affordable Care Act, all those funds' future is completely up in the air. We don't know what's going to happen to them. And the reason that the CDC moved those funds was the concerns about sequestration at the national level. That's why that took place. But anyway, the service provides a lot of support in helping people to become tobacco-free, if you will, and the groups in the community that are specifically supported with it are the non-Medicaid pregnant women, uninsured Native Americans, tobacco users diagnosed with cancer, and others with assistance who need assistance with treatment and nicotine replacement therapy. The prevention block grant of $6 million, the piece in here probably of most concern to us might be sexually transmitted disease and reproductive health education and outreach programs. As you know, we do have a STD clinic in the health department. We do receive some funds from the Department of Health and Human Services, and I don't know for sure whether those funds are part of this, but if they are, it would mean we would lose probably somewhere in the vicinity of $20-some thousand a year to help support the clinic. And then lastly, under immunizations, essential public health services for immunization efforts in the state will be reduced by 49%. That will be a huge hit in our budget if it comes to pass. We do receive immunization action plan funds for that purpose and other kinds of immunization support activities in the community. So it has some significant potential impacts on us if it moves forward. The other thing I would mention is that, just to help put this a little bit in perspective, under the Affordable Care Act, Medicaid expansion took place in Michigan through the Healthy Michigan Plan. We have roughly 8,000 people in Jackson County who are enrolled in the Healthy Michigan Plan. And about 1,000 people are enrolled through the Healthcare Exchange nationally for health insurance. So if the act is completely repealed, state legislation that approved the Healthy Michigan Plan almost 4 years ago at this point in time stated specifically that if the federal government's portion of the funding goes away or changes greatly to some extent, that the entire Healthy Michigan Plan could be eliminated here in the state. And that means we're going completely backwards in terms of people having health care coverage. So that's the real potential impact of not having the Affordable Care Act in place. Did want to let you know that Washington County Board of Commissioners did pass a resolution supporting the continuation of the Affordable Care Act, and that resolution is available if the board members are interested. We'd be happy to bring it forward for your consideration, and I would encourage you to consider doing so. The rest of my monthly report, if you will, is we have successfully recertified our maternal infant health program for another 18 months. That was a real positive for us and the staff. And we had an overall kind of an increase in the community in December of increasing respiratory illness. It looks like it's primarily influenza related. As you can see from my report, overall influenza A in the state has increased in Michigan. And also we had a reported influenza outbreak in a long-term care center as well in the community. And we work with the long-term care facility as well as any other folks at Henry Ford Legion's Health that we work with routinely on keeping them informed on what's going on with respiratory illness in the community. And just a reminder, we did so far in this influenza season, we have seen 15 child deaths in the state of Michigan to date. So that's related to influenza as well. And I have at the bottom here, health education, health promotion, a Safetyville final report. The number of classrooms who participated in this injury prevention program, if you will, increased from 39 to 43. So we're very pleased with the results of that program, and assuming we can continue to get funding through the Traffic Safety Commission, we'll continue to operate it. And that's pretty much my report for you today. Happy to take any questions.
Doctor?
Does data support the fact that if someone has lung cancer, encourage them to stop smoking has any beneficial effect?
That's a good question. We do get periodic reports from the Tobacco Quit line for people in Jackson County who have utilized it, but I don't think I get that kind of specific information. I don't know if it's been looked at quite that way, but I can try to find out if you'd like.
So my point is that you mentioned using resources on those people, okay? If the data shows that once you have it, it doesn't make any difference, okay, would that be considered not a good use of the resources?
Right. That's a good question. I'll do some investigation and see if I can find out anything further. That sort of data would probably be all resident at the MDHHS level, but we can ask if they have looked at it that way and if they have found it to be effective.
Yeah, it gets complicated because whether it's small cell or squamous cell and so on and so forth, any age. But I was just wondering, you mentioned the resources for doing that, and I was sitting here saying, well, if it doesn't do anything in regards to life expectancy or quality of life, it's a waste of money.
Absolutely, great question. I'll see what I can find out.
All right, very good. Anything else? Richard, congratulations. I'm sure everybody here will be looking forward to doing a survey. I'm sure everybody can't wait, and so you make sure you send it on everybody's way.
I will, and it will be relatively short.
All right, thank you.
Thank you.
Thank you very much. Okay, I'll need a motion and support for claims for January 1st, 31, 2017.
Second.
Okay. All those in favor, so I'm saying aye.
Aye.
Not, same signal. All right, thank you. And we have no other minutes. We have the March schedule. We'll have the Health Department, Lifeways, and Department on Aging. And now we're back to public comment. Public comments. Okay, seeing none. I won't miss this this time, Mr. Chairman. Do we have any committee member comments? Committee member comments? Okay, seeing none, at 12:36, this meeting is called by the chair.